Vina Febi's friend. How are you doing today? In this video, I'm going to talk about the relationship between fruits and diabetes patients. Please watch it. Diabetes is a medical condition characterized by high blood sugar levels in the body. It can affect the way the body processes blood sugar and can lead to various health complications if not managed properly. There are two most common types of diabetes, type 1 and type 2. Type 1 diabetes usually occurs in children or teenagers, where the body is unable to produce enough insulin to regulate blood sugar. Meanwhile, type 2 diabetes usually occurs in adults, where the body produces insulin but is not effective enough in processing blood sugar. Symptoms of type 1 and type 2 diabetes are quite similar and may include excessive thirst, frequent urination, fatigue, and blurry vision. Type 1 diabetes patients require insulin injections to help regulate blood sugar levels, while type 2 diabetes patients can manage their condition by following a healthy diet, regular exercise, and medications if necessary. In managing diabetes, a healthy eating pattern is very important to control blood sugar levels. Some fruits should be avoided by diabetes patients because they have high natural sugar content. Here are some fruits that should be avoided. 1. Banana. Bananas have a high natural sugar content, which can cause blood sugar levels to increase. In addition, bananas also have a high glycemic index, which means they can cause a drastic increase in blood sugar levels after consumption. 2. Dates. Dates are a fruit that is very rich in natural sugar and has a very high glycemic index. Therefore, diabetes patients should avoid consuming dates excessively. 3. Mango. Mango has a sweet and delicious taste but also contains a high natural sugar content. In addition, mango also has a high carbohydrate content, which can cause a significant increase in blood sugar levels. In addition to the fruits mentioned above, diabetes patients should also limit their consumption of fruits that are rich in natural sugar, such as apples and grapes. Instead, diabetes patients should choose fruits that have low natural sugar content, such as strawberries, blueberries, and kiwis. Fruits that are rich in fiber can also help control blood sugar levels, such as oranges, pears, and papayas. Vina Febi's friend. Here are some things to know about diabetes. 1. Diabetes complications. High blood sugar levels over a long period of time can cause damage to the body's organs and nerves, increasing the risk of diabetes complications. Some complications that can occur as a result of diabetes include damage to the heart and blood vessels, damage to the kidneys, damage to the eyes, such as cataracts and diabetic retinopathy, damage to nerves, such as diabetic neuropathy, wounds and infections that are difficult to heal, sexual problems, such as erectile dysfunction and menstrual failure. 2. Managing diabetes. Managing diabetes involves several things, such as keeping blood sugar levels stable by following the right diet recommendations, exercising regularly, and taking medications if needed. Monitoring blood sugar levels regularly using a blood glucose meter. Avoiding smoking and limiting alcohol consumption. Keeping blood pressure and cholesterol levels within healthy limits. Getting recommended vaccinations, such as flu and pneumonia vaccines. 3. Diet for diabetes patients. In managing the diet for diabetes patients, some things to consider include limiting sugar and high carbohydrate foods such as bread, rice, and pasta. Consuming foods high in fiber, such as vegetables, fruits, and grains. Choosing low-fat protein sources such as fish, skinless chicken, and legumes. Choosing foods containing healthy fats such as avocado, nuts, and olive oil. Avoiding fried foods and processed foods containing lots of salt and added sugar. Consuming fruits that have low natural sugar levels and avoiding fruits that are rich in natural sugar. 4. Diabetes treatment. Diabetes treatment may involve several types of drugs, such as oral medications, which can help the body process blood sugar and reduce insulin resistance. Insulin, which is given by injection to help regulate blood sugar levels. Other medications such as SGLT2 and GLP-1 inhibitors, which can help regulate blood sugar levels and reduce the risk of diabetes complications. 5. Diabetes risk factors. Some factors that can increase a person's risk of diabetes include family history of diabetes, obesity or being overweight, lack of physical activity, age over 45 years, high blood pressure or high cholesterol levels, women who have had gestational diabetes during pregnancy, certain races, such as African American, Hispanic, and Asian. 6. Types of diabetes. There are several types of diabetes, including Type 1 diabetes, a type of diabetes caused by a lack of insulin production by the pancreas. Type 1 diabetes usually occurs in children or young adults and requires insulin treatment. Type 2 diabetes, a type of diabetes caused by insulin resistance or insufficient insulin production. Type 2 diabetes usually occurs in adults and can be controlled by managing diet, exercise, and medications. Gestational diabetes, a type of diabetes that occurs during pregnancy and usually disappears after giving birth. However, gestational diabetes can increase the risk of developing type 2 diabetes later on. Other types of diabetes, such as diabetes caused by certain medical conditions or certain medications. 7. Prevention and treatment of diabetes. To prevent diabetes, a person can do several things, including maintaining a healthy weight and staying physically active, consuming healthy and balanced food, and avoiding foods that contain high amounts of sugar and simple carbohydrates, avoiding smoking and excessive alcohol consumption, maintaining normal blood pressure and cholesterol levels, regularly checking blood sugar levels, especially for those at high risk of diabetes. 8. Complications of diabetes. If diabetes is not well controlled, it can cause several serious complications, including peripheral neuropathy, damage to peripheral nerves causing numbness, tingling, and pain in the extremities. Kidney damage. Diabetes can cause damage to the kidneys and even trigger kidney failure. Diabetic retinopathy, damage to the retina that can cause visual disturbances and even blindness. Heart disease and stroke. Diabetes increases the risk of developing heart disease and stroke. Infections. Diabetes can cause a decrease in immune function, increasing the risk of infections. Vena Febi's friend. The conclusion of this video is: diabetes is a chronic disease that can cause various serious complications if not well controlled. People with diabetes should follow a healthy and balanced diet, regularly exercise, and check their blood sugar levels regularly. Although fruits contain many beneficial nutrients, people with diabetes should choose fruits with low natural sugar content and low glycemic index and avoid fruits with high sugar content. Insulin therapy, oral hypoglycemic medications, lifestyle changes, and regular blood sugar monitoring can help treat diabetes. In addition, people with diabetes need to pay attention to potential complications that can occur and prevent them by maintaining a healthy lifestyle. It is important to remember that anyone can get diabetes, regardless of gender, age, or ethnicity. However, some risk factors can increase the likelihood of developing diabetes, such as being overweight, lack of physical activity, family history of diabetes, and age over 45. Therefore, appropriate prevention efforts are needed to reduce the risk of developing diabetes. This can be done by adopting a healthy lifestyle, such as consuming healthy and balanced food, regularly exercising, and maintaining a healthy weight. Diabetes is not a disease that can be completely cured, but with a healthy lifestyle and appropriate treatment, people with diabetes can keep their blood sugar levels within normal limits and prevent serious complications from occurring. Thank you for watching this video, hope it is useful. Don't forget to subscribe to this video. Share it with your friends and don't forget to click like.